Hi, my name is Ashley Sweeney. I'm a registered dietitian. I have my master's in nutrition with a specialty in maternal and child nutrition. Today I'm sharing some tips with you about exercise and breastfeeding and how to go about that and how to get back into it, and some common misconceptions that I've been receiving. I'm also a mom. I have two little ones. I have a 2-year-old and I also have a 3-month-old, and I've started exercising again. And since sharing what I'm doing on social media and on Facebook and Instagram, I get questions all the time like, when did you start exercising? Can I do this workout? I heard I couldn't exercise when I was nursing. I heard it drops my milk supply. And so this is for moms who may be pregnant and thinking of nursing, or who are maybe nursing and have questions about starting up exercising again. Hopefully I'll be able to help you with some of those. So first one is that exercise decreases my milk supply, and that is not true. Most moms start exercising again, or a lot of moms do, around that 6-week mark. And that 6 weeks mark is also when a lot of other things are happening. You may be resuming medications like birth control, you may be going back to work, you may be still not getting much sleep, which if you're a new mom, you probably aren't. There's a lot of other stressors, and so a lot of moms are just quick to blame exercise when there's a lot of other things going on that can be decreasing your milk supply. When beginning to start working out or exercising again, you really need to make sure you already have your milk supply well established, and also that you're drinking plenty of water and eating plenty of healthy foods. So you really need to make sure that even though you're starting to exercise, a lot of water, your milk supply is already established. And a lot of moms will feed before they do exercise, before they go work out. That way it's not as painful on their chest, and also so that you're not interrupted by maybe feeding a needy little baby at that time. The second one is my baby doesn't like to nurse, or I heard the lactic acid can get in your milk when you are exercising and you're nursing. And only if you are doing 100% exertion workouts, like super strenuous workouts, is there a chance of some lactic acid going into your milk. And even then it's not harmful, but the taste for that of your baby, or the taste may turn your baby off. But most moms are not going to be starting out at strenuous exercises. They're going to be doing maybe moderate exercise, and there's been shown no lactic acid in milk at those levels. So you just want to make sure to wash your chest off, maybe change your shirt, change your bra before you feed again, because sometimes that saltiness of the sweat is maybe turning your baby off, not necessarily because the taste has changed of your milk. So just some tips about that. The third one is that I can't exercise or can't do blank exercise because I'm nursing. And there's no reason why you can't do any type of workouts when you're nursing. Some moms have experienced pinched ducts around their chest. If you were doing a lot of upper body, maybe weight training, so you just want to make sure if you notice any milk ducts starting to plug or starting to get clogged around your chest, and you're doing a lot of upper body, abdomen, or a lot of upper body workouts, then you may want to take it back a little bit from those and maybe just do some cardio, just some walking, maybe jogging. But there's really no reason why any other workouts should be limited when you're nursing. And this is if you have been cleared for exercise, or we're going to move into part 4, is I have to wait 6 weeks to exercise. And that is also not true for some moms. I'm not going to say most moms, I'm going to say some moms. I started exercising around 3 weeks. My bleeding had stopped, and there's no research or nothing that shows why a mom with an uncomplicated vaginal delivery with no heavy ripping and no complications can't start exercising sooner. But I do want you to, listen to your body. You do need to trust your own body, and if bleeding resumes, you need to take a step back from your exercises. And also, if you had a C-section, or if you had a complicated delivery, any issues with your pregnancy, or any issues postpartum, to really talk to your doctor before you start exercising, more than just light walks, which they would recommend anyways. So you really just need to listen to your body. I started again around 3 weeks postpartum because I had a natural, healthy delivery, that no complications, and I felt great. So for me, I was really antsy at that point to start doing something. So I listened to my body with some light cardio, dance cardio, and then I moved into some strength training pretty quickly, and maybe some jogging here and there. But it will take your body a while to resume back to the same endurance and strength level, so you do have to be patient with yourself. And don't expect to bounce back right away because you are nursing. Some moms do find they lose weight faster because they're breastfeeding, but a lot of moms don't. A lot of moms still hold on to a little extra fat until they're done nursing, and then that fat can shed off, but sometimes we save and hold on to some extra reserves for our baby. So I recommend moms nursing as long as possible and as long as you can. The guidelines recommend and encourage a year to 2 years, and so if you have the energy and the strength to do it, I really encourage you to do it because it's really amazing. And the weight in your body will change now as you're a mom, and it will fall off with time, but just you remember to be patient. And there's a lot of benefits to exercise, and postpartum, I really think some of those biggest benefits to exercising are to relieve stress, just to kind of feel a little better, just to kind of get a little break, and just to kind of punch out some stress. So if you have any questions at all, feel free to comment below and I'll get back to you.